My name is Corinne Feldman. I'm a physician assistant. I'm the director of Didactic Education at the University of Southern California's primary care PA program. I'm also an assistant professor of clinical family medicine at USC, and I've been in PA education since 2011. One of the things that we learned from the COVID-19 pandemic was the breadth and depth of the digital divide in our country. And because so many states, including the state of California where I am, had a safer at home order that came about very, very early in the pandemic, most of the healthcare that was being delivered was shifted to an online platform. And for some populations that worked really, really well. Our students at USC loved having telehealth and they adapted really, really quickly. And then for others, there was sort of an intermediate period. And then for some still, they really went to no access for healthcare because of not really understanding or having access to the technology or comfort level with the technology to be able to get their healthcare. The Geriatric Companionship program came about because we recognized within the Department of Family Medicine, where our PA program resides, that there was an element of social isolation related to our older adults in our community that suddenly, because of the safer at home orders, didn't have access to all of the things that enrich their lives and help them be connected to their family or to their communities. Social outings, even going to the grocery store became a really fearful experience. And so we were able to pair medical students and PA students with older adults in the community that were experiencing social isolation. And whether that was part of the technology divide of not feeling that they could access people through Zoom and things like that, but they still had comfort with their telephones. And that was something we could do. So it was a really empowering experience for both the students to feel like they were part of a solution to an identifiable problem and to recognize how social isolation really can negatively affect someone's health, especially an older adult who's aging at home now alone. I think what this illustrated to our students was the power of technology and the perspective that they carry themselves as students in a technologically heavy world and school setting, and that is not the case for everyone. I think sometimes we lack empathy in a particular area because we can't imagine what it's like for someone else. And because the companionship program was really geared at this idea of like a coffee and a chat and just calling a friend to check in on them and see how they're doing and what they're frustrated with and struggling with, allowed the students to not have to be the person with all the medical answers, but just to listen and really understand that lived expertise of the older adult they were paired with, to understand what this feels like. And perhaps down the road, I think telemedicine is probably here to stay, but what we expect of every patient ought to change based on what their comfort level is with the technology we're asking them to engage in. And I think this program really allowed the students to experience that with a companion.